Hello, I'm Dr. Reynolds, and in this video I will be reviewing the pre- and post-operative instructions for implant and bone graft surgery. Let's first discuss pre-operative care. Our office will provide you with a copy of our bone vitamin regimen. This is a list of vitamins and supplements that have been proven to help with bone density. There are 9 in total, and you may already be taking some of these. Or you may be able to find multivitamins that contain several of the vitamins on the list. It's a good idea to start these vitamins right away. We recommend taking these vitamins for up to 2 years after the surgery. The 3 days before your surgery, you will begin using Closest mouthwash. Closest mouthwash is an over-the-counter mouthwash and can be found at your local drugstore. Please use the Closest mouthwash 3 times a day leading up to your surgery. On the day before the surgery, you will begin taking an antibiotic that you have been prescribed. If you are having IV sedation for your surgery, please do not take the antibiotic on the morning of the surgery. Remember to brush your teeth the morning of the surgery. If you are having IV sedation, please do not have anything to eat or drink for 8 hours prior. Oftentimes, modifications will need to be made to your normal medications. This is on a case-by-case basis, and any changes will be given to you in writing at your preoperative appointment. After your surgery is complete, we ask that you do not brush your teeth or rinse for the first 24 hours. Day 1 is the day of surgery. That evening, you will begin using Stella Life gel. Apply it directly on the surgical sites with a clean finger. Starting on day 2 and day 3, you can begin gently rinsing with Closest and room temperature saltwater rinses. We ask that you do not vigorously swish, but tilt your head back and forth for 30 seconds and then lean over the sink to let the fluid run out. This should be done 3 times a day. On day 4, you can also begin carefully brushing using the GCMI paste and the soft bristle toothbrush that we have provided. Do not let the toothbrush touch the surgical site. It is a delicate area, and brushing right over it will cause damage. Electric toothbrushes and water picks may not be used during the healing phase. After surgery, please eat or drink when you feel ready. For the first 72 hours after surgery, we recommend a cool pureed diet, such as a smoothie, just without a straw. Starting on day 4, you can progress to warm and soft diet. Absolutely do not chew over the surgical sites for 6 weeks. If you need guidance on what to eat or drink, please reference the back side of your postoperative instruction sheet for a list of approved foods. At the bottom of the sheet, you will also find foods that you should avoid throughout recovery. Please note that any form of nicotine can be detrimental to the surgical site and should be avoided for at least a week, preferably longer. If you cannot stop nicotine products completely, then try to reduce the consumed amount and use a patch instead of any oral nicotine such as smoking, vaping, gum, or pouches. To help mitigate swelling, bleeding, and hematoma formation, please use the cool packs and facial compression band provided to you. Leave the band on full time for the first day. It has pockets for the cool packs, which can be slid out of the pocket, leaving the compression device in place while you recool them in the freezer. You will likely have stitches at the surgical site. These sutures will be removed at a future postoperative appointment. Starting the day after surgery, we want you to begin opening your mouth and moving your jaw side to side several times per day. By doing these jaw joint stretches 3 to 4 times per day, you will avoid muscles becoming tight, which can cause severe limited opening during recovery. Swelling and pain will increase for the first 3 days after surgery. Many patients report that day 3 tends to be the worst. You may receive 2 prescriptions for postoperative pain management: ibuprofen and hydrocodone combined with acetaminophen, sometimes called Norco. Hydrocodone is a narcotic drug, so please remember, when taking this medication, do not work, drive, or attend school. With these medicines, take with food in your stomach and drink plenty of water. Your first line pain defense should be ibuprofen and Tylenol. If you have no restrictions, we recommend 500 milligrams of Tylenol and 800 milligrams of ibuprofen every 8 hours. Some patients may have different dosages depending on their age and weight. Hydrocodone should be used for breakthrough pain only. On your postoperative instructions, you will find the daily recommended limits on each of these drugs, so be sure not to exceed those limits. Additionally, at the bottom of your post-operative instruction sheet, you will see a written time for your next dose of ibuprofen. Because you were given a similar medication through your IV for the procedure, do not take ibuprofen until this time. Tylenol can be taken right away. In addition, you may be given a manila envelope with 4 tablets of dexamethasone or a prescription for Medrol dose pack. Please begin taking this the day following surgery. The antibiotic should be resumed the night of the surgery. While taking antibiotics, it is our recommendation that you take pre and probiotics. You may receive a removable prosthesis. This could be a denture, a partial denture, a flipper, or a clear retainer called an Essex. Your prosthesis should be worn 24/7 for the first 2 weeks after surgery. If the prosthesis is painful to wear, please take it out immediately and call our office. The prosthesis should be removed 3 times daily to be cleaned and allow you to perform regular oral hygiene. Once the gum tissues cover the surgical site, we will reduce the time needed to wear the prosthesis to 8 hours a day. Remember that rest is important during the recovery process. We wish you a speedy recovery, and we are always here for you. If you have any questions or concerns that this video or the post-operative instruction sheet did not address, please call our office at 970-663-6878. Thank you.